try to give you a view of what I consider a boot camp of the journey I've been through. And what I really want to take and try to get through to you guys is the chaos or the emotions that occur when it first hits you, when you're going through the diagnosis phase, you're going through treatment, and you basically don't know what's going on. You know, are you going to be treated? And you get into the maintenance phase, and you're basically fearing that scan every 3 months, or every 6 months, or every 9 months, and something like that. There's a whole series of it hits you. Okay, I'm going to do is we're going to briefly go through the guidelines. I'm going to sort of mention some of the initial lessons, and then I'm going to actually go back and try to highlight sort of the lessons I learned, or things I wouldn't do, or things, you know. It sort of seems like some of these things should be, you know, patently obvious, but believe me, they did seem very obvious to me, and I think those of us that have gone through this, yeah, if you can actually get introduced to this now, and you actually end up in this adventure, whether you like it or not, hopefully some of you guys will take this away and maybe stay a little bit above the crisis stage before it hits you. Okay, we're going to dig deeper. Disclaimer right here. I'm not a social worker. I just happen to be a software engineer that happens to have gone through this. So, you know, and I'm not a medical professional also. Okay, basically, September 3rd, basically Labor Day weekend. Previously, about a month and a half earlier, I had actually ended up with a Taekwondo injury where I hurt my shoulder with a board break that went bad. It wasn't healing, and we were on vacation. I ended up with like a week and a half migraine, came back, and we had blood pressure, 220 over 190. And I was being treated for, you know, we were trying to basically stabilize my blood pressure. Ended up, we thought we had it under control, went out of control Friday night, ended up in the emergency room Saturday morning. While we're in there, basically the doctor asks whether I want to, you know, do I have chest pains? My wife says, well, I didn't think you had chest pains, believe me, with a blood pressure of 220 over 190, if you don't have chest pains, it sure as heck feels tight. They took the x-ray, the radiologist saw shadow. He asked for a CAT scan. Got the CAT scan, and unfortunately, we basically found a 5, or, you know, going on 6 by 4 by 5 centimeter mass in the lung. And, you know, the attending doctor said, oh, you have a mass in the lung. Basically, oh geez, now what? Okay, took me 9 days. We actually got in to see a pulmonologist, and this was the first event where you have to start filtering the information, and you have to start asking questions, and if you don't believe, or, you know, you have to ask some really hard questions at times. What happened was the pulmonologist basically went to me, well, we could actually watch and wait. We could basically just sit and wait for a month to see if it grows. And at that point I said, absolutely not. We're going to actually do the biopsy as soon as possible. And sure enough, we basically got the scheduled biopsy. We did a CT-assisted biopsy. Went in, and yeah, it was not painless, but basically they did the biopsy. Unfortunately, I ended up there most of the day because my lung, you know, the lungs started pulling away from the back of the lung. So biopsy. 2 days later, I'm sitting in with my doctor, my primary care doctor. We're talking about my blood pressure, trying to figure out what's going on, and the news comes in that, by the way, the first installment of the biopsy report comes in. At this point, he actually, literally what happened, he actually went out to get another piece of paper, and he actually saw the results. He came back in and said, Jim, the biopsy results are back in. It doesn't look so good. And so then we sat down, and we went over the biopsy report as it sat there, and I was kind of going, huh? And the interesting thing about this, and my primary care doctor, I really, really like him. He actually sat down, and there was actually an intern with him. And after he gave me the news, we talked it, he actually sat down and said, okay, what could I have done better? What could I have done better to actually break the news and educate you? And other than maybe asking whether the intern was there, he actually did a very good job. And the neat thing about it was he immediately started scheduling the MRI and the PET scans. He jumped on it. There's a couple other blood tests because actually we were questioning whether the nets I had basically would possibly induce it. One of the possibilities was nets with respect to one of the high blood pressure I had. So he started that, and we actually ended up going, and I actually, for those of you who have not gone through the biopsy procedure, effectively it comes in stages. Think of it as a decision tree, and actually as you get further down the decision tree, you do different tests as you actually proceed down further down the decision tree. So the information comes slowly trickling in. And so, you know, literally, basically, we started getting more information. We also had the PET scan scheduled. And this is when all heck broke loose. You can see here, already 36 days, the tumor's already growing. we actually now know why basically maybe my shoulder was hurting, because it actually started going through the pleural cavity and started involving my ribs on the right side. So I was getting referred pain basically from my lung back into it, actually activating my right shoulder and my right arm. My right arm was just basically aching. And unfortunately, we actually found some stuff in the lung and the liver. So I basically went straight to stage 4, metastatic, with no known primary. And that basically hits you upside the head like 2x4. At this point, you don't know what the heck's going on. You see, now, the thing that is kind of interesting here is you'll see that we're 36 days in. You're wanting to get results. You're trying to get appointments. They take a long time to give you. You're trying to get the appointments. It seems to take forever to schedule it. It's like a hurry up and wait. You try to get the appointment, get the results, and guess what? The results may not be conclusive. And that's exactly what happened to me. And also, at this point, I go back to pulmonology. The pulmonologist says, we don't know what it is. Do you have your affairs in order? That was not what I needed to hear at that point in time. It was true that they presented the tumor board in the pulmonology department. They did not know what it was. And at that point, I was basically redirected to oncology. Hematology oncology down at Sharp. Also at that point in time, actually, for those of you from Qualcomm, the best doctors that they keep sending you those cards about, it actually works very well. So what happened with us is I basically started activating the best doctors for a second opinion. And what they end up doing, it actually works very well for me, is that they basically do a background, they collect information, you actually try to get the release of all your information. They actually then go and find an expert that actually matches what they're seeing. And for me, that actually had to find an expert that was in both sarcoma and in melanoma. And so that expert, we basically got the information to him. One thing you're going to find out if you actually end up on this journey is trying to get your records out of the medical system actually to the second opinions. It took absolutely forever. I did not get the second opinion until 134 days, basically about a month and a half into when I was being treated before we actually got the final second opinion result. Okay, let's keep going. Oops, sorry. Well, also what happened is when I was saying that these pathology results were trickling in, I was actually, unfortunately, the initial results I only had like S100 and SOX10 and S100. And those are basically, that doesn't distinguish the cancer very well, other than it was undifferentiated and had a sarcoma-type features when they actually look at the first pathology reports. Later on, I actually ended up with effectively a marker, PD-L1 marker, and luckily my tumor had 80% expressed PD-L1 and the surrounding tissue had 20%, which actually that actually pointed to that we were actually going to try to treat melanoma. And it also means that it may be my plan B if I actually fall out of my current state of no evidence of malignancy, that we can actually go back and actually use effectively the melanoma or ipi-nivo, basically an immunotherapy to try to attack it. So what happened is about this time, you can see we're 80 days in. We don't know when we're going to start treatment. We really don't know what we're treating. And I'm getting very nervous. At this time, I'm still having a fair amount of pain. Even by the time I made it into my oncologist, I was having extreme pain. I would basically be waking up in the middle of the night, having to take basically opioids basically every 4 hours. I was getting very little sleep, starting to get insomnia. Quite frankly, the only thing that got through me the night is hearing my son and my wife breathing in the bed next to me. Those nights were long, 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 long. And then also what happens about this time, we were actually trying to figure out what the heck was going on. There's a molecular test that some doctors order, tissue of origin test, a molecular-based test. That test came back, and the problem that my wife, myself, and actually my wife's at her PhD is in immunology in microbiology and immunology, and her boss is in I think biochemistry or whatever. But they basically started researching it. And our worry was that the database was not large enough that you could actually make a definitive diagnosis based on those type of results. In hindsight, that's definitely the case, because what we finally ended up for my diagnosis was a relatively rare cancer, and the reality is that they do not have a big enough sample to make it statistically significant. But it gets a little bit more interesting here. First cycle, 65 days, we started the first cycle of ipi-nivo, which is effectively an immunotherapy used to treat melanoma. So we started that cycle, went through the orientation and start that. You read you read the diagnostic, the prescribing information, you look at all the side effects, and you kind of go, well, there's not much choice in the matter, we're going to actually go for it. We start the cycle. Unfortunately, about a week and 3 days later, I get a call at 9 o'clock at night from my oncologist. He was at a conference. And what happened was the tissue of origin test came back in, and it said 90% probability of sarcoma, less than 10% probability of melanoma. And so his advice at that point in time was to actually abort the immunotherapy cycle. So they put me on a high dose of prednisone for a week, and then we started tapering off the prednisone. So basically we abort the cycle basically after about 10 days. Now the interesting thing is we'll never know whether that cycle actually did, I suspect that cycle actually did some good, but we'll never know. Okay, so at this point in time, we changed the diagnosis to sarcoma. And my type of sarcoma is called undifferentiated pleomorphic sarcoma. It's a grab bag. Okay, first thing, sarcomas. Okay, as the previous doctor mentioned, you have carcinomas, you have sarcomas for soft tissue. And unfortunately, there's about 80 different types of sarcoma. And UPS is, well, at least the current designation, happens to be a kind of a grab bucket of everything else they can't classify. So you know what that does for trying to take it and find statistics for trying to be able to take it and find results. So at that point in time, I take my first round of chemotherapy. And by the way, since we have already basically started going through the rib, we don't know where the primary is. They say it's not resectable, and we don't know where the primary is. So at least, chemotherapy is systemic treatment. We can basically knock everything down, see what happens. About this time, in that previous June, it's the conference in June for oncologists. That conference. Dr. Tapp out of MSK basically presented the results for laratumab, eventually was commercialized by Eli Lilly as Lotruva. It was the first drug in like about 20 years for taking and trying to basically offer, doxorubicin, which is the chemo I was on, is basically a relatively old chemotherapy drug. And this is the first thing. It wasn't standard of care at that point in time, so basically I was a month after it was approved at the end of October. We found that was a new approved drug that was basically orphan drug status, fast-tracked, and was available. And so we got approval for it, and I probably could have asked for it in the first cycle, but I wasn't sure at that point in time. And in hindsight, we probably should have, but it doesn't matter. So we basically added it as of the second cycle. With the chemotherapy I had, doxorubicin, or adriamycin, the trade name was doxorubicin, it's cardiotoxic, so you get basically 8 cycles of it if you're healthy enough, maybe 5 cycles if you're not, and that's it. You can't take it anymore. It's cardiotoxic. In the last 3 cycles, I had to take a cardioprotectant. So actually, after the first cycle, we added Lotruva in the second cycle, and so we basically did, basically the first cycle of chemotherapy. That was basically 116 days in. Continued it on until basically middle of May that year of 2017. Then we started a maintenance drug with using laratumab, and we continued that all the way until January of this year. Nobody knows the results. They had no results for this, but we basically contacted Dr. Tapp at MSK, and at that point they're saying, well, there's no reason. If you're tolerating the drug, we might as well stay on it. And so we stayed on it. So these cycles are 21-day cycles. So I take an infusion on day 1 and take an infusion on day 8, take 1 week off, and start the whole thing over again. We did that for basically, I basically did it all the way through to January, and I think that ended up being something like 70 infusions. 40 of those infusions were peripheral, 40, about the other 30 were basically via port. And we can talk about that. If you guys are in this situation, don't wait to get your port put in early. I made that mistake, and we'll get to why I was so hesitant to get the port a little bit later. Okay, this is where it gets interesting with respect to, this is where you need to start asking questions, and just because they said you can't have surgery initially, doesn't mean you can't keep asking. What happened was that we were in a situation that I actually responded relatively well. My lungs actually responded well. The tumors in my liver actually shrank down, but there was one lesion that continued there, and it basically wasn't responding. So at that point in time, after we had finished we stopped in May, and basically around the end of September, beginning of October of that year, I asked why we couldn't do surgery. And at that point, my oncologist kind of looked, well, I guess we could ask. And so we actually went to an interventional radiologist and asked, and he said, absolutely. And he knew it was sarcoma. He wasn't a sarcoma specialist, but he actually knew the importance of actually getting sufficient margins in trying to do the surgery. In hindsight, we probably, in hindsight, if I knew it had sarcoma, I probably would have gone to a sarcoma specialty center, but by the time I was in what was going on, and we were actually treating with Dr. Rubis, and I actually felt relatively comfortable with the second opinion that finally came in. So we actually signed up, we actually went in, they froze out a 5-centimeter portion of my liver. They use argon gas at the tip of a needle. It's CT guided. They grow it. You see the ice crystal forming. You stop it, pull the needle out, and basically I went home the next noon. I basically had it in the afternoon one day. I was released from the hospital the next day around noon. And I had asked for morphine once in the middle of the night. So it was actually, I was walking around, immediately. I was basically practicing Taekwondo in about a week and a half to 2 weeks. So the surgery was relatively easy. We continued treatment until this January. Okay, oops, sorry. Let me go here, sorry. Okay, you look at this, it looks like a relatively, I wouldn't say easy ride, but it looked like, okay, treatment, we do this, we switch diagnosis, and we go like that. Unfortunately, it wasn't that easy. And what happened after my first cycle, I ended up in crisis. I could hardly walk, I could hardly talk, I couldn't swallow. And there was probably multiple reasons, well, there's actually a whole bunch of reasons for why I ended up in this situation. One, we actually ramped off very fast off prednisone, which, it was an extremely fast ramp. I accidentally dropped off lorazepam, so if I had any anxiety issues, I just amplified them. And this is the big one for me. What happened was we were actually trying to make the decision to actually add Lotruo to my treatment plan. I actually ended up reading the abstract and started reading the paper that was basically formed the basis of the orphan drug approval, the clinical trial that the paper was written on SCEP. That's at the point in time that I realized I basically was exposed to the numbers that for what I had, median survivability was 12 months. That's median. And with liratumab, it basically brought the median up to about 24 months. So it was a no-brainer, but then this is the first time I came to just realize how bad options were. And I don't know how much it was mental, it doesn't matter. The fact of the matter is I could barely walk, and I was literally paralyzed by fear and anxiety. When I was we were supposed to have a treatment that week, December 21st. That day, I was supposed to actually have a chemotherapy with Lotruo. I was in no position to be treated. We took a week off, but one of the things I asked my doctor at that point in time was I felt like the disease had taken everything away from me. Literally everything. And I was asking why I couldn't do some of the things I wanted. I couldn't practice Taekwondo because supposedly because of blood pressure. But I needed to do something. And I asked him, why can't I take control of my life back? Why can't I train? And he actually said, there's probably no reason I can't. And this is, for me, was probably the turning point where I decided to, rather than follow, try to take control, and at least try to control some aspects of what I was going through. And it was a turning point. I had started a support group the week before, and that actually ended up being very important too. But fundamentally making that decision, it really comes down to, it comes down to trying to take some control of your life back. And that was so fundamental for me being able to actually get in the mindset that I could actually go through the treatment and be able to continue this for multiple years. Now, the reality is that the treatment I have is non-curative. So, I'm terminal. Okay. What that means to me is to get your head wrapped around is, okay, what can you do? Quality of life issues become important. And the reality, and we'll get to a little bit later, is that just because you're on palliative care, that buys you time. And they're doing lots of research in adjacent cancers and stuff like that. The cancer I have is rare. It's one of the rare ones in sarcoma. But there's other drugs that are being treated, and you'll actually see this is a common pattern. They basically get approval for one drug, they get approval for a clinical trial in an adjacent area, and they're actually able to do it. And so, at least my mindset, whether it's true or not, my mindset was, okay, fine, we're going to look at this as effectively a chronic disease. We're going to try to survive long enough and see whether our treatment comes in. And that's what it did. Now, okay, we're going to switch gears now. Now we're going to start looking at some of the lessons I learned. I sort of touched on a little bit, but one of the first things is what I call information or prognosis management. Some people don't want to know the prognosis. Some doctors give it to them. Some doctors don't. Sometimes the time's not right. So you have to decide what information you want and what level of information you want. Is it the right time? Things like that. And you have to work with your care team and stuff like that. Work with your spouse and stuff like that. My wife Karen was basically reading the papers and her friends, but she wasn't giving me that information because I was not ready for it. I was nowhere near ready for it. It wasn't probably until the end of January of that year before I actually started feeling comfortable with that. It's kind of interesting. I mean, initially it was fear of dying, then it was fear of not living. Fear of not living, fear of not, oh, hold on a minute. Then it slowly shifts over from fear of dying. It's not that you lose the fear of dying. You still have it there. It's not the thing that's controlling your thoughts every day. And then it's not the fear of not being able to live my life the way I want to, the fear of not being able to enjoy it, the fear of not being able to get some of the things done. And then eventually, it's kind of interesting. How do I describe this? And I think most of the survivors today, your personality goes through a series of changes. It changes you to the core. I mean, if you had told me 3 years ago that I would be actually sitting in front of you, actually giving this talk, or standing in front of you giving this talk, I was extremely introverted, very passionate about my work. But this disease has changed me a lot. And actually, in some respects, for the better. I mean, I have a I changed my outlook, the way I approach life. I changed the outlook, what I do. It reinforced the fact that, I was lucky in the sense that I had already looked at my priorities when I retired and decided that I wanted to retire and be a stay-at-home dad because of that. Luckily, those priorities happened to be the same priorities that I did after I was diagnosed. So it wasn't a total shift for me, but it's a big shift. Okay, let me keep going. How much information? And, the source of information. But one thing, obviously, I heard somebody use the term, don't go to Dr. Google. So there's a lot of information out there. Some is good, some bad. It's hard to filter it. You have to be careful where you're getting your information. But that doesn't mean you don't want to you don't want to ask questions and stuff like that. You just have to basically be able to evaluate the information and get the people you want to be able to evaluate the information. Okay, self-advocacy. Actually, I have some notes here. This is something that actually, I didn't think it would be as much necessary, but it was kind of interesting. Like, for example, the pulmonologist wanted to actually wait. There's no way I wanted to wait. I actually had to state my wishes and what I wanted to do and go forward with that. Other examples, the fact that I had to advocate for actually adding Latrubo into my treatment plan. This was not standard of care, so I had to basically push the doctor to do that. Let me think, there's several others. Research, 1 second. Shoot. Okay, whatever. Investigating, and then also for the fact, I don't think my oncologist would have actually added surgery back onto my plan, but guess what, my case, all of our cases are unique. There's no reason you can't ask, and you might as well. For me, that was the only way I got to go out into malignancy. I did the surgery, we did the PET scan after that. At that point, I've been, at that point we reached no evidence of malignancy, we continued treatment, and so far I've been clean since then. And it's a reoccurring thing in the support group that I go to. I actually go to advanced cancer, living with advanced cancer support group at Sharp, East Field. I'm sure there's basically similar support groups at almost any medical organization. And I can't emphasize that actually had played a major part in being able to cope with this also. Very major part. And also social workers also. And almost everybody to a T in my support group has had to basically push their treatment team to make sure that they were in sync with what they wanted, especially as things changed and as they got through multiple decision points. The other thing is, and it became extremely prevalent for me, as you get further in, actually after 8 rounds of chemo, If anybody tells you chemo fog isn't a real thing, it actually seems to be very real, at least for me. I basically have relatively serious short-term memory issues. And so literally, you need to bring somebody in to your meetings with your medical care team, or record the conversations, or whatever was necessary. Because one, even if you're not having short-term memory problems, a lot of information is hitting you. You are probably emotionally involved. You don't realize what's happening. What you hear may not be what the doctor was saying. It's good to actually have somebody else there. My wife with me, and then the ones where my wife couldn't go with me, I basically recorded the conversations, and that way I could go back and see what we discussed and stuff like that, and take notes from it. Questioning, obviously, if you don't think something's right, question it. On that topic, if you look at my second opinion, his opinion was actually don't use the molecular test for diagnostics. And in speaking to some also the people that actually did my second opinion, part of it is the database is not large enough. Eventually the databases will consolidate across the, basically multiple databases will consolidate, and the tumor databases will get big enough, and then I can see it being that. I mean, you guys can speak to that, whether that's or not. But as a patient, we felt drastically that it was wrong. In hindsight, it doesn't matter. We treated the disease. How are we doing on time? Okay. Oh wow. Okay. Dealing with uncertainty. For me, that was probably the number one key thing. I had to actually get something back that I owned. For me, what that meant was I got back on the Dojong floor and started training. I actually was speaking to the people I trained with. I came back in January of 2017. I came back at 132 pounds. I started in August at 163 pounds. I basically was completely gone. I would do a 90-degree turn. I'd probably basically not pass out. I basically was dizzy. I basically had fallen down. But this was one of the places that I could actually forget that I had this darn disease. And there's only two places for me that did that. It was church for me, or going and practicing Taekwondo. And yeah, okay, keep going. Now, it may seem obvious. You'll hear people say that your attitude, it can make the biggest difference. If you look at the research results, it's not as clear as you might think. On the other hand, there's relatively good research results that basically say continued stress and anxiety actually is highly correlated with, basically a suppressed immune response. And if that isn't enough to basically mess you up, it doesn't matter. I mean, the fact of the matter is that getting yourself in the right mindset and being able to approach it, if nothing else, makes the quality of life, for me, made the quality of life a lot better. For me, for meditation, I was doing mindful mantra, walking, and passive meditation. I cannot tell you how many miles and how many times I basically listened to affirmations for hour and hour and hour. And there's many nights I basically listened to, a whole bunch of Tibetan chants, all through the night because I couldn't sleep. But hey, it's what allowed me to return to some type of peace, something to get me through the night. Okay, hold on, I'm slowing down unfortunately. Support groups, oncology, social workers and clergy, and support networks. I cannot emphasize how important they are. I am absolutely amazed at how many people stepped up. Brought us food. Kevin and Anna, and Theo. Kevin and Anna, they were taking my son to Taekwondo because I couldn't drive. I had people from my dojo taking me up or taking me home, stuff so I could actually train even though I was on morphine. I couldn't drive. And Rahul and Kirthi, Kevin and Anna, and Vito and Ruth. Vito went down with me. I don't know how many infusions Vito went with me, but he was there when I could talk to. And some people may not feel comfortable and may back away, but others will step up and let them help you if you can. It's obviously your choice, but I was absolutely amazed. We had food coming in, people were taking me places, they were taking my son. While the chaos was going on, I just could not process that, but things had to go on, and they really helped. The support group is unbelievable. It's the first time. And it's interesting, let me really emphasize this. What happened was that I went to the support group. There was 2 people that were stage 4, that had been stage 4 since like either 2003 or 1997. That was the first time that I realized, well, wait a minute, maybe it's not all over. Maybe you can actually live with this. And that was exactly the same reaction that happened to Barbara and Juliet themselves when they started it. Barbara ended up going down to MD Anderson. Her oncologist, basically, she was being treated here. She went down for a specialist down MD Anderson. And guess what? That day she was down there, one of the former patients was an oncologist, like 10 years out. She came back once a year from the Philippines back to MD Anderson to get her yearly checkup. That's when she realized that, wait a minute, people can survive this. Not guaranteed, but at least you have some hope. And that helped her, and then the people in the support group, that actually helped unbelievably me. And every one of the people that have gone to our support group, that seems to be the reoccurring conclusion. Reoccurring conclusion. The family network and friends is unbelievable. Learning how to ask for help and when to say no. There are certain things you can't do, and luckily for me, my wife Karen was able to actually do some of the things. I don't remember much of my son's kindergarten year because just so much was going on. I literally don't remember some of that, and it bugs me, but it's the reality. I'm gonna have to keep moving. Faith and spirituality. I had always wanted to do some reading. That was one of the things I wanted to do when I retired. Actually, do more exploration and stuff like that. Well, boy, nothing like the time now when you actually start facing your mortality. You start dealing with some of those issues. I'm sort of stuck between Western and Eastern religions. And that's fine. That's what works for me. And it all comes down to this: finding that strength to fight, live it on your own terms. May not be, you may not win, but at least you can basically, you get to control some of the quality of your life. Some, not all. Okay, that was mindset. Let's keep going. Pain management. I sort of mentioned it before, but as soon as I started with my oncologist, one of the biggest things that happened is that we switched to basically extended release morphine. If you're not sleeping through the night, start asking questions. Start asking for help. For me, once I actually got on extended release morphine, I was actually able to get the sleep. It partially dealt with some of the insomnia, but I actually was able to actually get enough sleep that I could actually start getting stronger. Because prior to that point, I was not sleeping. I would basically end up till all the way through about 5 or 6 in the morning. I actually start getting a couple hours of sleep. I might get a couple more hours after my wife left or my son went to school or something like that. But I was getting on average about 4 hours, 5 hours, maybe off and on, but it was not good. So pain management. And unfortunately, it seems a lot of us end up with insomnia. I went through every med in the formulary, and I finally ended up on, basically THC, CBD. That was the only thing that worked for me. It's the only thing that continues to work for me today. At some point, I'm basically taking the great lectures course in CBT. Maybe I'll back myself off of THC and be able to CBT. But the fact of the matter is that, everybody I know seems to have ended up with some issues in this area. Okay, you gotta. Given that in stage 4, you don't know where the primary is, it's palliative. Let me rephrase that. For UPS, the doxorubicin, the treatment known is basically not known to be curative. For me, the way I had to basically, literally, as I mentioned, you basically have to think about it as chronic disease. But that does help to get your head wrapped around that, because the reality is that, there's not going to be a curative treatment around tomorrow or something like that. Okay, exercise. For me, it was gigantic. Absolutely gigantic. On the second cycle, I was only able to walk down a couple of houses, but I kept pushing myself. Every day, I was out there with my headphones on, listening to basic affirmations, and trying to walk. By the time I was in cycle 6, I was doing 6 miles after my day of chemo. I made the mistake of actually doing Taekwondo with the cardio protectant and ended up with like 103 temperature. So, take a little bit of, moderate a little bit. But for me, that was a big thing. That exercise was my escape. Also, fatigue. It's going to hit you. I think for me, exercise helped mitigate some of that. The other thing is, for me, it's also plan B. If I fall out and actually end up going progressive, I know for a fact the matter of the next round of chemo is not going to be very easy. So the better shape I'm in now means the better chance of survivability. side effects. They're real. For me, this is actually probably one of the more frustrating things. I literally, partway into like about the third or fourth things, I go to leave the house, it would take me a half an hour to find my wallet, then my water bottle, stuff like that. They were scattered the house, I could not remember where they were. So I had to start developing systems. I put tiles on everything. And at least that way I could hear the darn thing beep, but I could find it and actually get out of the house rather than taking a half an hour to leave the house. I use to-do lists like you would not believe now. They're gigantic, not all of them are done, but at least I get the stuff written down and I can figure out. I use things like something to actually keep me focused on the laptop. Am I on task? It reminds me every 10 minutes, it asks you, what are you working on? And it helps. You basically have to actually end up with, some way of trying to cope with this. It is so frustrating, especially if you were organized before. The next thing you realize, you can't remember what you started. You can't remember what you put. You can't remember, The good thing is, guess what? You get to read books multiple times. I mean, literally, you forget you've read the book and it's still enjoyable the second or third time through. So, I mean, there's certain things there. Hold on, let me go. You have neuropathy. For me, I ended up with neuropathy. I don't walk with a cane anymore, but I still, like half my right foot is all the way past my ball of my foot. I have balance problems. It makes it things. I have to matter of fact, while I was under treatment, we ended up with a glass shard in my heel all the way up. We didn't realize it was in there until 2 or 3 days later when it actually hit the nerve. But yeah, so it's a real thing. You have to basically sort of follow a similar protocol that you do with type 2 diabetes. You have to inspect things. Fingers, it's really easy to take my blood sugar. I don't feel my finger prick anymore. Okay, let me get to conclusions. And I sort of touched on this. It will change your personality down to the core. But it's not necessarily for the bad. One, I think I have a more honest approach to life now. I want to basically, I probably have a low tolerance for certain BS. I used to be somewhat outspoken. I'm even more outspoken. I'm less reserved. I'm much more extroverted now. I don't know. Maybe my wife could say whether that's good or bad, but that's the reality. The other thing is that how do I describe this? Some of the people I've met, it's kind of hard because I lost 7 people in 2017 to cancer, that people I know are close friends. Part of it is, guess what? One of the groups I hang around with are all stage 4 cancer people. But I will have to say, some of the friendships and some of the people I met are some amazing, and I would have never had the opportunity to meet them. And, that's good enough. Thank you.